Hi, everyone. I'm Dr. Tiff Jumeli from Integrative Pediatrics in Studio City. And today I'm here with my good friend and colleague, Dr. Coleman. And she's a physician who works with ketamine with patients here in Los Angeles. So thank you so much for joining us.
Yeah, thank you for having me. It's exciting.
Wonderful. I'm so glad you're here. Today, we wanted to talk a lot about postpartum depression. I know with new moms, it's obviously a joyful, wonderful experience to bring a new baby into the world, but that also comes with a lot of anxiety for people, a lot of restless, sleepless nights, not having time and trying to take care of a new baby when you don't really know how to do that just yet. And for some moms, that can manifest with a little anxiety or a little baby blues. But for some people, it can be more severe and can be kind of classified as the postpartum depression group.
Yeah, I think, it's a thing that's not so much talked about, or, women just kind of accept that maybe they don't feel good or they have guilt around not feeling so great, right? So they don't want to bring that up. But really it affects women worldwide. And I think there's an estimate up to like 15% of mothers actually experience postpartum depression. And not only does it affect them, but it affects the family as well, right? So it really can have effects on the infant, because the relationship and the dynamics between the mother and the infant is affected by the depression. So it goes beyond just the mom in affecting a lot of different elements of family. And I think that we need to do a better job of bringing it to awareness in treating moms.
Right, absolutely. I mean, not only, that interaction between the mom and the baby, that bonding can be really affected. There's less breastfeeding often that happens when moms are suffering with postpartum depression. And the relationship between mom and her partner can be strained, obviously, at the same time. I was even reading there can be longer term effects on the baby where they can have, delays or developmental issues with their learning and,
Yeah.
psychomotor skills, because if they're missing out on that really important bonding time or things are, a little bit impaired at the beginning, it can have, long lasting impacts.
Yeah, and I think there happen like there's maternal withdrawal, disengagement, and if we want to talk about the term trauma, I use the term trauma loosely, meaning like I think it's Gabor Mate who says trauma is just anything that's caused a wound in us. A lot of us as adults who experience these woundings come from childhood wounding, right? And that has a lot to do with like attachment and things that happen to us in really early stages of life. And those are the hardest things actually to kind of repair or heal through. And so this time when we're infants and we really need that bonding and engagement and learning these social cues and learning safety really can be impacted and affect us in multiple different ways as we continue on in life.
Yeah, absolutely. Absolutely. And so we've really got to figure out a way to not only remove it from this stigma area where people are willing to talk about it. I mean, I feel like it gets relegated with other mental health things where people just don't feel comfortable sharing that just yet. And it's really unfortunate because it's a disease the same way as any other disease is and needs to be treated. But we need to figure out how to treat it. Like, how can we safely treat a mom when obviously she's, just had a baby, she's oftentimes breastfeeding. And we need to be very careful with what we use to make sure that it's not going to adversely affect the baby, right?
Yeah, I think we're doing just to touch on the awareness. I think part of what COVID has done is brought mental health into awareness. And so hopefully we're kind of moving in the right direction in that way. But yeah, there's a lot of things to consider around treating women who are either pregnant or just postpartum. And there are women who suffer with depression and become pregnant, and that adds another element, right? So the way that we treat depression, anxiety predominantly in this country is through antidepressants, predominantly SSRIs. And we know that there are risk of being on SSRIs while women are pregnant, and also risk of exposure in breastfeeding in postpartum. And we're always weighing the risks and benefits, because there's also risks to allowing a woman to remain in a depressed state when they're pregnant and breastfeeding as well. But these are treatments that people get on and usually stay on for quite some time. Mm-hmm. So, if you ever heard of a friend or somebody who's like, oh yeah, I'm on an antidepressant, they're probably have been on it for like months, years, forever. And they kind of, it doesn't always come up to come off of it. And because a lot of this is being treated through primary care, that maybe they don't have the support. The other issue that we want to consider is like, what does that exposure mean for the baby, right? So when we're breastfeeding, there are lactation studies showing varying results of how much concentration of the antidepressant is going to the baby. and which antidepressants have which concentrations. And really there's not like good evidence showing that what the consistency of that concentration, and there's very limited data showing the long-term effects, whether they be neurodevelopmental, whether they be behavioral, whether they actually be physical, and cognitive. There's a lack of studies around this. So we don't know what that actually means. And like I said, because these are ongoing treatments, one, it takes a while for the treatment to kick in. So you're going to be on it for at least 2 to 3 months because people want to see if it has an effect, and then longer. And so we don't know how long babies are getting exposed. The other thing that's worth mentioning is that because this is our mainstay of treatment, SSRIs, people think, well, that's the only thing I can do, but it also doesn't help a lot of people. So, SSRIs are great and they save some people's lives and necessary. And some people don't really have a good effect, or they have a lot of side effects. So, it could also relate to like sexual dysfunction, having issues with like your relationship when you're, all of the things that you're trying to kind of prevent by treating depression, you may also have as a side effect. Right. Or it doesn't work. And then you're on a second SSRI, or you're switching medications, and during these stages, people can actually get worse or become suicidal. So there's a lot that goes into that. So we need to be starting to look at what are safer options for people to get help.
Right. No, absolutely. And it's very scary with the baby, especially you're changing the serotonin reabsorption with these selective serotonin reuptake inhibitors, the SSRI that we talk about. And so, yeah, if you're messing that up with changing that in a baby, are they going to grow up and need them to become dependent? Or like you said, there's a whole range of effects that could or could not happen. So obviously we don't want to be experimenting on our kids, but like you said, depression is very serious and needs to be treated. So yeah, what other options are there? I mean, I was reading briefly, I don't know if you know too much about this, but I was reading that in some really bad cases, they can do like electroshock therapy with postpartum depression.
Yeah. I mean, it's funny that like, also not like ECT, I'm just going to abbreviate it, but I remember like watching ECT treatments in residency, and it just seemed so archaic to me. Like that's what we still do to people. But, with people who have really refractory depression or treatment resistant depression, which, the definition of that is there's not an accepted definition, but usually failing at least 2 types of medication. It is a treatment that people still use. I don't know a lot about when people will go to that treatment. It does feel kind of intense and severe, but where I work with ketamine. So for me, oh, go ahead. Sorry.
Yeah, let's hear about ketamine. That sounds like, let's learn about it.
So, similar to you, I'd like to practice in a very integrative way. So, depression and mental health is just a manifestation of what's also going on physically. So, obviously just doing diet, health, supplements, all of that is not always going to completely help people feel better. But I think all of those are important. So like, I'm not ignoring all those things. I'm just going to focus kind of on ketamine. All of those aspects also need to be included. So ketamine is a legal medicine that we've had since the 1960s. It was used a lot in the 70s in Vietnam War because it can be used in the field. It works as an anesthetic in a pain medication, and it doesn't suppress respiratory drive, and it's very safe. It started to be used in the 70s in mental health conditions as well. So where I use ketamine is in this area. So I use ketamine to treat depression, to treat anxiety, to treat trauma, and other types of transformational work as well. So I use ketamine as an intramuscular injection into the arm. So similar to like how you would get a vaccine just going into the muscle in the arm. It creates a psychedelic experience. It creates a separation of mind and body that allows us to have a different perspective on things in our lives, and really can help shift people and change the way that they feel about themselves and their relationships with others, and therefore improving depression. So, I mean, there's a lot I can go into, and I'm happy to go into all of it. But one of the benefits of this, what we're seeing in postpartum depression, is that ketamine is meant to be done in like kind of a short treatment. So like we do it as what we call an induction treatment, usually doing 4 to 6 sessions over a short period of time. And that's like 2 to 3 weeks usually. And then you kind of see how people do, and they may need booster shots here or there, but it's that we're doing it short. So we're not going to be on it forever. And also some of my friends have done, some initial studies looking at, does ketamine stay in the breast milk, or how long does it stay in the breast milk? What's the concentrations? And so they look not only at the concentration of ketamine, but also like a few of the metabolites, or, once it's metabolized, the other active components. And of all of these, after 12 hours, they're essentially negligible amounts. Even like 6 or 3 hours, there's very little amounts of it. So people could have a ketamine treatment, and they could, planning ahead, they could like pump and dump, and after 12 hours, they could go back to breastfeeding.
Oh, amazing.
And knowing that their kid is going to not be getting the effects of ketamine.
Right.
Interestingly enough, ketamine is also used in children as an anesthetic. So really, it's probably pretty safe. We don't use it in patients who are pregnant currently. But because it's used safely in children, there probably isn't very much risk to begin with. But just taking the extra precaution.
Yeah, that's amazing that it clears out so fast. And then with the goal being that you do this induction treatment and then don't really need to use it frequently on a regular basis going forward.
Yeah. And, ketamine on itself does physiologic work to the body. So it works on the NMDA receptors in the brain. So a different receptor than the serotonin receptors. And what we think is one of the main pathways to the antidepressant effects is that it works to really build new neuronal pathways. So it's actually targeting things in the brain that create these new cells and these new pathways, so that we can get what we call neuroplasticity. We're changing the brain. And that's where we think a lot of this antidepressant work comes from. So, but besides that, we do know that these effects can be short term. So what really helps is doing what we call integration or integrative therapy along with the ketamine. And that can be done by a therapist or somebody trained with kind of psychedelic work, psychedelic medicine, ketamine work. And that's really like helping the person take the experience they had while they had the medicine and making sense of that for their life, and then creating actionable changes that can really help them be in the practice of strengthening these new connections that they've made in the brain.
Wow, that's really amazing. So not only, so different from a standard kind of antidepressant treatment where you're almost masking the symptoms, you're kind of forcing, extra neurotransmitter that's going to make you happy. This is really changing the way the brain works. And so you're actually treating and like fixing an issue rather than just kind of masking symptoms sort of long term. That's great.
It's, kind of the same idea of going towards the root, right? So when we think about like, how do we do with like integrative medicine versus just kind of traditional Western medicine? Well, instead of treating symptoms, we're kind of trying to get at the root of what's causing the symptoms and looking at that. And, the other benefit is that ketamine has pretty rapid effects. So some people start to feel better almost immediately after the first session. Some people it may take 2 or 3 sessions, but this is, in contrast to having it take like 4 to 6 weeks for an antidepressant to start working.
Right. And that's a long time when you're depressed and feeling terrible and also have a screaming baby.
Right. Yeah.
So that's great that it works so well. And what about like, you've been seeing results pretty quickly with your patients?
Yeah. I mean, the number that when we say induction 4 to 6 sessions, that comes from research. So we do know that some patients won't see benefits until the 4th session, but honestly, the majority of my patients do see a difference after the first session. At most, I'd say all of my patients by the 3rd session. So it's really just kind of depends on what they're coming with, what they're looking to treat, kind of what's going on in their life. But they're pretty profound experiences. So, it's about how it's done. So I use ketamine really in thinking about it as a psychedelic experience and psychedelic medicine. So we pay attention to people's mindset going in. We work with them about why they're coming to this work. What are your intentions? What are you looking to get out of it? And then when they're in the actual getting the medicine, I do it I have a therapy setting office. They're laying on a couch. They have an eye mask on. They have headphones on that have like specific type of music. It's really about creating a safe space for them. And I'm with them through the whole 2-hour appointment. So they're never by themselves. And it's really like when they come out of the medicine experience, just trying to like have them remember about their experience, start that integration process. So it's really like being in relationship with somebody as they're going through this treatment, because it's very different than what we do in like normal everyday Western medicine. This is a whole different type of therapy and relationship with patients.
Right. And you're with them through it. So for those patients who might be a little wary or are not familiar with using psychedelic medicines themselves, you're with them to try to make sure it's a good experience and that they use that experience in a therapeutic way.
Yeah. And, when some people have some knowledge about quote unquote psychedelics or what that means to them, and, people will talk about a bad trip. And to me, what that means is that a few things probably happened. They either had a dose that was way too high for them, they didn't expect, or they were in an unsafe setting or with people they didn't feel safe with. Because that's when things start to get like, when you get worried and feel overwhelmed. So we control for all of those things specifically, because we also know that by paying attention to mindset, paying attention to setting, really doing dosing in a certain way, these are where the biggest benefits come out of doing work with these types of medicines.
Wow, that's amazing. That's amazing. So what kind of patient would you think would be a good candidate? Like a postpartum mom, like how would she know if she'd be a good candidate for this type of thing?
Yeah, it's, there's a few different types of people. I think that it's either people who have struggled with depression, maybe even before pregnancy, and maybe it's gotten worse. People who have tried antidepressants before and they haven't really had an effect, or they've had side effects, or people who really don't want to take medication. So, there's this whole conversation that mothers have to have about like, well, I have to put my baby first. So, and, this worry about like, am I doing something unsafe for my baby? But is it helpful for me? But there's this whole drama that has to like play out with moms, and all this pressure that gets put on them externally, because everybody else has an opinion about what they should or shouldn't do.
Of course they do.
Everybody has opinions, and they feel free to share them with you at all times. So, I think it's a number of different people. It's like any mom who feels like she's struggling, and, if she feels uncertain about like what to do, as far as, I don't want to take medications. I have, and they haven't worked. So it's if you're open to kind of changing the way that you feel in a way that's going to be positive, and doing it in maybe a different way, and in a way that's going to provide very low, if any, risk to your baby, but potentially give you a lot of benefit, and then improving the relationship that you have with your newborn baby.
That's amazing. That's amazing. That's such a great information, because I feel like the word is not out yet about the great benefits, and this is being an option for people. Moms don't think about it. So I'm so glad that you're, spreading the word and you're helping people like this.
Yeah, I think, we live in LA, and it's a great place for this type of work, because it's more open-minded, and people, and there's more people doing it. But it's starting to get a little bit more out there, and a lot of this is just education, right? So people don't know about it. They don't know that it's an option. And, it sounds like something scary or something they've never heard of. So, the first step is always education. I talk to people before they like go ahead and sign on for treatment. I usually do phone consults, and most of that's answering people's questions. And I love to talk about ketamine. I love to talk about this work. So I'm always happy to answer questions. And, you never want to push people into something. It has to really feel like they have to feel comfortable doing it. And I think that the way that people can feel comfortable is by having a lot of information.
Yeah, I think you're absolutely right. So that's wonderful. And so where can people learn more? Where can they find you on the web, or
So my website is www.stephanielynwellness.com. Lyn has one N. I have an Instagram page that's Stephanie Lyn Coleman, MD. My phone number, email address are both on there. You can schedule a consult from I think either place. And I'm going to be talking at a conference in Vegas about psychedelic medicine, and people in general have, questions about psychedelic medicine. It's called Meet Delic, DELIC. And that's the first weekend in November, in Vegas. So there's a lot of ways to kind of get in contact with me. And, I think the best people can do is just kind of start getting a little bit more education, and being open to doing something different, and knowing that like, it's really powerful work, and it really does help people.
That's amazing. That's amazing. I agree. Like getting the information out there and knowing what options are available is like the first step to finding what treatment's going to work best.
Yeah, for sure.
Perfect. Thank you so much for coming on and chatting.
It was so fun.
A lot of people gained some good information and learned something new today. So wonderful. Again, I'm Dr. Tiff from Integrative Pediatrics, and we'll see you next time.
Thanks for having me.
Thank you.